Good evening, everyone, and welcome to daily full-scale mock test and discussion with Dr. Murali Bharadwaz. I hope you're all answering the full-scale grand test on the Incus learning app. Every day morning, one new test is being hosted. And then in the evening at 6 p.m., we will be having a discussion. And every day you should realize 20 to 30 topics that you need to become better. And then you need to go back to the Incus learning app, and there you have 2000 HD videos which are available, topic-wise arranged, and you can go and do a quick revision, 20-30 minutes, one topic is done. You also have PowerPoint notes, everything available on the Incus learning app. So like that, every day, if you are improving 10 to 20 topics daily, then automatically you become the topper in the NEET PG exam. For the next 40 days, we are going to journey together. So let's make the great beginning, doctor. Now, what is the diagnosis? What is your diagnosis when the patient say, oh, the CVA is after me and they're tapping my phone? It is called paranoid delusion is what you need to emphatically remember. So the different types of delusions and the delusional syndromes like Clermont, etc., you need to be 100% sure about. Now, paranoid delusion, there's an irrational belief that one is being persecuted is called paranoid delusion. What is your diagnosis when a patient has a belief that one's thoughts can be heard by others? It is called thought broadcasting is what you should remember. In thought broadcasting, one strongly believes that his thoughts can be heard by others. मैं जो सोच रहा हूं दूसरे लोग सुन रहे हैं, जो मैं सोच रहा हूं मेरे विचार को कोई सुन रहे. Wow, that is thought broadcasting. When the patient is saying, I am the all-powerful son of the God and I shall bring down my wrath on you if I cannot have a smoke. So what is that called? Delusion of grandeur. I am the king. I am all-powerful. That is called delusion of grandeur is what you need to remember. A patient is withdrawn, lack of enjoyment from social interactions, emotionally restricted. What do you call? It's called schizoid personality disorder. Now, one of the important challenges you need to know is what is schizophreniform, schizoaffective, schizotypal. Let's look into it. Schizophrenia is a lifelong psychotic disorder. Very good to see Dr. Anupama. Thank you, Dr. Anupama, for giving a very good compliment on the Google Play Store. In fact, our students are our brand ambassadors. We don't need to do any advertisement. So I also request many of you, if you can go to the Google Play Store, Incus app, and can write few nice comments with a 5-star rating, that will help us to take the app onto the top of the list. So please do that. And also bring a lot of your friends. Please inform. Even though we are free, still to make everyone know that we are available free every day evening 6 o'clock. 6 to 7:30 for a full-scale grand test. Very few people know. So that is the reason. Please do become our brand ambassador. Drop a line along with the download link of the Incus app in all your WhatsApp groups, wherever you are. Now, doctor, schizophreniform disorder, that is schizophrenia for less than 6 months. Schizoaffective, affect क्या होता है? Mood. So schizophrenia plus the mood disorder. Schizophrenia plus the mood disorder. Whereas schizoid is a personality disorder. So the person is very shyful. He has lack of enjoyment. He is completely withdrawn from the social interactions, emotionally restricted, which is called schizoid personality, is what you should remember. Once more, if you go back to the Incus app, you have 2000 HD videos, each of around 20 to 30 minute duration. If you go to psychiatry, you have personality disorders. One of the favorite topic of the examiner is what you need to remember. So Varun is asking, sir, in the mock test, within 20 seconds, the question is changing and we are getting the lead board. And how many answered A, B, C, D? Please increase the time. But the question is, if you are really good, if you are really, you know what is that typical high yield point examiner is asking, there's a very little to think in the real exam. Let me tell you, if your thinking means you are losing the mark, you have to be 100% sure about it, Varun. So that is the reason. Slowly, 4th, 5th, 6th test tak aapko aadat ho jayega. You will become habituated to answer a question within 20 seconds. Speed is one of the important traits which says that your concepts became strong. No time to think in the real exam hall, actually. So, doctor, major depressive disorder, the average age of onset is 40. That's the reason the moment you celebrate 40th birthday, people call 40 Club. Welcome to 40 Club. Seasonal affective disorder during winter. People go into depression. It is a subtype of maniac depressive disorder. Major depressive disorder. DSM-4 criteria requires no history of maniac or hypomaniac episodes for you to diagnose the major depressive disorder. So you should know the DSM-4 criteria for the diagnosis of major depression. And once more, I want to tell you, doctor, totally we have discussed 20 hours and 50 short videos are available for you on the Incus Learning app under 2000 HD video program subscription. So please do enroll. In this 20 hours, पूरा साइकियाट्री में जो भी एग्जामिनर पूछने वाला है, आप एकदम तलवार के तार के जैसे तैयार हो जाएगा. Right? Now, major depressive disorder, there are episodes of depressed mood with loss of interest in daily activities. Reading room को जाना बोले तो बोर लग रहा है, मॉक टेस्ट लेना है तो बोर लग रहा है, पिक्चर जाना है तो बोर लग रहा है, पूरा दुनिया में कुछ भी करने के लिए बोर लग रहा है. No interest, Baba. No. That is depression. So it will be very vague, somatic compliance, basically. So now, doctor, the lifetime prevalence of anybody getting major depression is 15%. Average onset is 40, twice more often in the women. No ethnic or socio-economic difference. पैसे हो या नहीं हो, अमीर हो या गरीब हो, राजा हो या बेगर हो, हर एक को डिप्रेशन होता है. And the prevalence in the elderly, especially to live an elderly age, is the most nightmare as you keep aging. Mother Teresa said, more than the tuberculosis, more than the cancer, the worst thing is being unwanted, nobody to talk, and we become obsolete when we become elderly. That is the most, it is the most difficult problem of life, being unwanted. So, doctor, I like to quickly throw you a question. What is your diagnosis? What is causative organism? What is treatment? Chalo. Let us make it an interactive session. Please punch your answers, doctor. What is your diagnosis? What is causative organism? What is your treatment? Come on. Let me check how good you are reading. Out of 200 questions, you can easily expect around 20 to 25 questions which are image-based questions. So you should be 100% be ready with all these spotters. Who is going to give me the correct answer? What is the diagnosis? What is the organism? What is the treatment? I am just waiting for you to punch the answers. Let us make it interactive. Come on, doctor. Punch, punch, punch your answer. Very good. Varun, absolutely right. Carry on. It is the trichophyton tonsurans which lead to carrion, which is a inflammatory form of tinea cavitis, which is caused by T-cell mediated hypersensitivity to this causative dermatophyte. It is what you need to remember. Gallstones are because of resection of which part of the gut? It is the distal ileal resection which lead to gallstones. So ileum is the place where there is a bile absorption. Any decreased bile absorption lead to lithogenic bile and lead to the formation of the cholesterol gallstones. Irritable bowel syndrome. There is an alternating diarrhea and constipation. There is an abdominal pain which is relieved by bowel movements. And there is a diarrhea that increases with stress. They are all the true statements. But there will be no loss of weight. If there is a significant loss of weight, always doubt your diagnosis of irritable bowel syndrome. Maybe there is a carcinoma colon or something and you are missing that. So weight loss is not there. If it is there, it is against the diagnosis of irritable bowel syndrome is what I want to underscore to all of you. Internal hemorrhoids which are prolapsing, and with manual you are able to do the reduction. What do you classify it as? Third degree. First degree, no prolapse. Second degree, prolapse with spontaneous reduction. Third degree, prolapse with manual reduction. Fourth degree, permanently prolapsed. That is what you need to remember. A young man presents with solitary thyroid nodule, which is of a least value out of all this. Once FNAC has come, doctor, there is a very little role for the radioisotope scan. So ultrasound, thyroid function tests, FNAC, they're all done. But radioisotope scan, not much of a great value. So the radioisotope scan has no value, FNAC is available. A patient is admitted with subarachnoid hemorrhage. Lumbar puncture is effective to make a diagnosis of subarachnoid hemorrhage. An aneurysm is more likely to cause a subarachnoid hemorrhage. Aneurysm is more likely to cause than a brain tumor. Hydrocephalus can occur as a consequence of subarachnoid hemorrhage. CT scan, very valuable. If there is a subarachnoid hemorrhage, you can see the bleeding into the sylvian fissure. You can see hydrocephalus, etc., etc. So CT is highly valuable. A young patient presents with headache, fever, and suggestive features of temporal lobe space occupying lesion. If you are suspecting a brain abscess, what do you want to do? Most patients with brain abscess need evacuation of the pus. And there's no role for a non-interventional management trial. So unless it is very small, but most of the brain abscess require drainage, either by aspiration or burr hole, or by craniotomy. It is a simple principle, doctor. Pus anyway, remove the pus. Pus anyway, remove the pus. That is the rule. The commonest of the syndromes with cleft lip is Pyrion. What is Pyrion syndrome, doc? Cleft palate plus retrognathia and glossoptosis is called Pyrion. Now, erythroplakia, leukoplakia. There are some other lesions which can lead to the cancer. So you should remember, chronic hyperplastic candidiasis, you should treat with antifungals. Submucous fibrosis, if it is there, person cannot be able to open the mouth, trismus will be there. And siderophrenic dysphagia, Plummer-Vinson syndrome, it presents with anemia. And syphilitic glossitis is like a burnt out disease of syphilis, not an active syphilis. So no role for penicillin is what you need to remember. So I'll be running really fast, doctor, so be very sure. Morning as you wake up, before you are going to reading room, open the Incus learning app and 100 MCQs you have to solve within 45 to 50 minutes. So what will you do? You have to quickly finish the test. There is already this PowerPoint which I am going to deliver in the evening is already available on the Incus app. After finishing the test, you can go to the history. So then you decide what are the 10-15 topics that I really gone wrong in this mock test and prepare. And evening I will come and we will have a discussion. So make it a journey all the next 40 days. Automatically you will get a seat. Now, whenever there is any fungating growth on buccal mucosa with enlarged neck nodes, take FNAC of the nodes, biopsy of the oral lesion. So that is very much the part of your management. So biopsy is mandatory. Coming to salivary gland tumors, if they are less than 1 centimeter and benign, they should undergo excisional biopsy. Now, a 70-year-old female, progressive dysphagia, weight loss, swelling of the neck that becomes prominent on swallowing the fluid. A thin barium is showing a pharyngeal pouch. Pharyngeal pouch. How do you want to treat? You want to do the surgical resection of the Juncus diverticulum is considered to be the management of choice. A 60-year-old male with laryngeal cancer presents with stridor cyanosis. So you are planning an emergency tracheostomy. So you will make a vertical skin incision. Vertical skin incision. So the second, third, fourth tracheal rings are the ones which are cut vertically. So what is a collar stud abscess? It is a tubercular abscess on both sides of the deep cervical fascia. So typically TB leads to collar stud abscess. And a collar stud is a button typically used to fasten the collar corners. So that is how TB abscess will look like. Thyroglossal cyst. It is most commonly situated below the hyoid. It may present lateral to the thyroid cartilage, and a 2 centimeter cyst should be excised even if asymptomatic, and it moves both on the protrusion of the tongue and also on swallowing. Both the things will lead to the movement, is what you should remember. A toxic nodular goiter in a 30-year-old female, how do you want to manage? Surgery. So whenever there is any toxic nodule, it responds poorly to the drugs, and surgery is the treatment. So it is a hemithyroidectomy, which is considered to be the usual operation. Triple assessment of the breast. Now, what are all included? Fine needle aspiration, mammography, and clinical examination. A young female smoker presents with a greenish brown discharge from the breast with pain and redness. There is a subareolar mass and a slit-like retraction of the nipple. What else is required? That is the classical clinical presentation of ductectasia. So treatment is with antibiotics, anti-staphylococcal plus anti-anaerobic. If this fails, surgery is needed. You do what is called Hadfield operation. Hadfield operation क्या होता है? Cone excision of the major ducts. A patient presents with 6 centimeters malignant breast lump and 2 hard mobile nodes in the axilla. Now talk about axillary node dissection. If there are any axillary metastasis, it implies a high possibility of systemic disease. And this patient needs axillary surgery, and the patient will need chemotherapy, whether pre or post-menopausal. But removal of axillary disease will not improve long-term survival, because removal of axillary node only helps in your loco-regional recurrence. That's what you need to appreciate. T1N0, M0, well-differentiated breast cancer. Now, you have injected blue dye. Sentinel node is stained. So what is true? If the node is negative, axilla don't need clearance. But if the node is positive, axillary clearance is needed. That is the sentinel node, which is the first node which is drained by the tumor. Now in a newborn with tracheoesophageal fistula, a nasogastric tube typically cannot be passed more than 10 centimeters from the mouth. Then it will wind up. So typical esophageal atresia kaisa hota hai? So upper part of the esophagus ends like a blind pouch, and the lower part become connected with the trachea, That's a tracheoesophageal fistula. Now, which part of the gut is very sensitive to ischemia? Is a very, very important question. So, which part of the gut? It is the stomach, which is most sensitive to ischemia, and it recovers most slowly after a hypovolemic insult, is what you need to remember. A 70-year-old male patient presents with upper GI hemorrhage and hypotension. After resuscitation, upper GI endoscopy is done, which shows duodenal ulcer with evidence of recent bleed. So how do you want to manage? Endoscopic injection of the sclerosant to control the ulcer. You have to do the surgery and suture the bleeding ulcer. Surgery, suture the bleeding ulcer, and anthrectomy with vagotomy. They're all the accepted management. So anthrectomy plus vagotomy is a definitive operation. But once upon a time, it used to be very popular. But nowadays, endoscopic treatment is popular. Now, with regard to the gall bladder, what is Moyenham's hump? It is the right hepatic artery anatomy variation that makes it susceptible to injury during cholecystectomy. In the cystic duct, you find valves of Keister, and the gallbladder does not produce cholecystokinin. Who produces? Small intestine produces, and that leads to contraction of the gallbladder, releasing all those enzymatic secretions is what you need to remember. With regard to the biliary atresia, you should remember the lifespan of an untreated child is usually less than 3 months. Most of the patients are jaundiced right at the birth. It is one of the important causes of the pathological jaundice. And the atresia affects the bile duct, common hepatic duct, the right and left hepatic duct, everything. And the sex incidence is almost equal. A 35-year-old healthy female presents with severe biliary colic, gallstones are being found. How we want to manage? Treat the patient conservatively, prepare for surgery, and operate as an elective surgery, not an emergency. Unlike appendicitis, there is no need to shift a biliary colic for emergency surgery. Appendicectomy means emergency, no waiting. Now, 10 days after laparoscopic cholecystectomy, a 35-year-old has mild icterus, right hypochondriac pain, low-grade fever, and 10 centimeter diameter localized collection in the gallbladder fossa. So what is your management? So you need to drain it. So percutaneous insertion of the subhepatic drain is considered to be the management of choice. Now, a patient is operated for diffuse peritonitis from a perforated appendix. Post-operatively, he develops a small pelvic abscess. Pelvic abscess can present like diarrhea, and patient complains of lower abdominal pain. And with pelvic abscess, if you do rectal examination, PR, you can find a cystic bulge, and laparotomy is infrequently needed. That's the point. Now, a patient presents with mild abdominal pain after a traffic accident. Now, you should remember that the patient needs surgery because of the finding of the bile. When you have done the diagnostic peritoneal lavage, bile stained peritoneal fluid is there, means it is an indication for surgery. So the presence of bile, RBC is more than 1 lakh per cubic millimeter, they mandate the surgery, is what you need to remember. Hirschsprung's disease. So in this, there is a hypertrophy, not atrophy. Hypertrophy is what you need to remember. Hypertrophy is what you come across. There's a dilatation of the bowel proximal to the diseased segment. And the involvement of the lower segment along with the rectum is most common. And Hirschsprung's is characterized by the absence of the ganglion cells in the nerve plexus of the intestine. Now, laparoscopic cholecystectomy, what is true? If you take open cholecystectomy versus laparoscopy, there is a higher rate of the bile duct injuries. That is true. Many believe it is the second trimester which is the best time for surgery, because the time miscarriage chances are lesser and the uterus is usually small enough not to interfere with the laparoscopic approach. That's the reason laparoscopy, if you want to do, second trimester of the pregnancy is the best time. Now, doctor, a 51-year-old, 8-month history of periorbital hair growth, pink fluorescence under the wood slag. What is your diagnosis? This is classical of porphyria cutanea tarda, which is due to uroporphyrinogen decarboxylase enzyme, the most common porphyria. Now, doctor, supracondylar fractures of the humerus. They are more common in the children of the age of 10. And most of them are hyperextension, not flexion injuries. And a brachial artery compromise may cause a forearm compartment syndrome, not an upper arm compartment syndrome. And you need to give a trial of immediate closure reduction is what you should remember. Coming to the ulnar nerve compression, it can present with weakness rather than pain. Now, it usually requires nerve conduction studies. It is less common than carpal tunnel. And even there is no pain, if there is weakness, that is enough an indication to do the surgery in ulnar nerve injury is what you need to remember. There is a swelling in the upper humerus of a 10-year-old boy. What is the most common underlying cause? Osteogenic sarcoma, acute osteomyelitis, Ewing's tumor. There are commonest swellings in the upper humerus in case of children. Shoulder dislocation most of the times is anterior, but in those who have epilepsy, electroconvulsive therapy, there they can be posterior dislocation. So, shoulder dislocation is the commonest joint dislocation in adults, and you can treat it with Koch's method. And it is the Hill-Sachs lesion which can predispose to the dislocation. Most dislocations are all anterior shoulder dislocations. Now, coming to the fracture of the proximal humerus, in the older people, they are very common. A 25-year-old comes to emergency after a road traffic accident. There is a mild abdominal tenderness, iliac crest springing for the pelvic fracture is positive. Then how do you want to manage? Immediately IV fluid shuru karo, careful examination karo, send blood for hemoglobin cross matching. First ब्लड प्रेशर स्टेबलाइज करो, बाद में देख लेंगे डायग्नोस्टिक पेरिटोनियल लवाज करना या नहीं करना, वो सब देख लेंगे. 55-year-old fracture of both the pubic rami, patient is hemodynamically stable, he is not passing urine, bladder is full. Don't try to do a misadventure of passing the Foley catheter here. You ought to do a suprapubic catheterization in this given scenario. Now, a 62-year-old woman with a history of fall while bathing, she is hemodynamically stable and the attitude is external rotation. So the patient, given the clinical picture, likely has an intracapsular fracture of the femoral neck. Most of the times plain X-ray is enough. Surgical reduction and fixation is always needed. No role for conservative treatment. The commonest complication of a intracapsular fracture of the femur is a non-union, not malunion, and avascular necrosis. A 13-year-old boy closed stable fracture of the upper tibia, excessive calf pain. What do you want to do? You have applied cast and all this developing. That means There is a impending compartment syndrome. So that is the reason the first step is to remove the cast. Now coming to the ankle fractures, all the undisplaced fractures, they should be treated with a cast. And whenever there is any supination on the forefoot with the external rotation of the ankle, fracture of the ankle occur. Very marked tenderness, swelling, and late complication of arthritis is what you need to remember. Retinoblastomas are familial, often unilateral, can be cured without surgery if they are small. You can also cure with radiotherapy or laser treatment. Coming to the conjunctivitis, soft contact lens, it can lead to giant pupillary conjunctivitis. When viral conjunctivitis is there, it is thinner, more watery. Gonococcal conjunctivitis is more common in the newborn than in the older children. And which virus can lead to conjunctivitis? Adenovirus. And vernal conjunctivitis typically is found in spring. Cataract, macular degeneration, optic neuropathy, everything is painless, but glaucoma is a painful cause of the blindness. Amaurosis fugax, where there is episodic fleeting blindness, where patient says, "Oh my doctor, there's a curtain falling before my eye." It's typically caused by the emboli, the shower of emboli. A 5-year-old, there is a cystic non-tender swelling on the lateral border of the left eyebrow. What else is needed? It is dermoid. So, most of these dermoid tumors present like a dumbbell lesion. So, it's always better to do CT before excision. Concomitant strabismus. Typically, it is a manifest squint in all the directions of the gaze. The deviation of the squinting eye is constant. Any obstacle in the childhood for the development of the binocular vision will lead to concomitant strabismus. And concomitant strabismus is not present since birth. It starts by age 3 to 6 months, completed by 5 to 6 years, is what you have to appreciate. Direct versus indirect ophthalmoscopy. Without that question, examiner is not going to leave you. So you should remember, image is erect, virtual, 15 times magnified, and it is more magnified in the myopes and less in hypermetropes. But direct ophthalmoscope cannot provide you any stereoscopic view, unlike an indirect ophthalmoscopy. Retinal vein occlusion. It's more common than CRVO, more than CRAO. It is common in patients with primary open angle glaucoma. Polycythemia is a risk factor. They're all true. And with regard to the sympathetic ophthalmitis, any injury to the uveal tract will release the antigens and the other eye will react with a hypersensitivity that lead to development of sympathetic ophthalmitis. So it's more common in children than in adults. The wound is in the ciliary area. It is a penetrating wound. But if actual suppuration, if it develops, then sympathetic ophthalmitis is less likely to develop. Coming to the pathological hypermetropia. It is the posterior subluxation, doctor, not anterior, that lead to hypermetropia. That's a point of interest. So, doctor, with this, we come to an end of today's discussion. And once more, if I get time in the night, I will, there are 40 more questions. जरा बाकी है आपको वो भी खत्म करूंगा, टेंशन नहीं है. नाइट में 11 o'clock or 12 o'clock before I go to sleep, I'll conduct one more session. But what I want to tell you is, doctor, I am your companion every day for your preparation until you get the seat. When I am there, you have no reason to say, टेंशन आ रहे हैं, एंग्जाइटी हो रहा है, मैं कब पढ़ूं, कैसे पढ़ूं. फिक्र ना छोड़ दो. सुबह उठते ही इनकस ऐप खोलो, 40 ग्रैंड टेस्ट का आज का ग्रैंड टेस्ट खत्म करो, 10-15 टॉपिक्स पिकअप करो, not more than that. Go back to the video library, quickly do the revision. Already PPTs are also there. शाम को मुरली भरद्वाज के साथ चाय पे चर्चा. You do this for next 40 days. देख लो, आपको सीट नहीं आए तो मेरा जिम्मेदारी, right? And always remember, yesterday is gone, tomorrow we don't know, but today, now, we should live now. अभी शुरुआत करना है. Every moment we have to make a start. Good luck and God bless you for your preparation.